India on Thursday crossed the grim milestone of 2 lakh coronavirus infections. This is the highest in a span of 24 hours. Now, this is double of what India saw in the first peak of COVID-19. From 1 lakh cases to 2 lakh cases, the United States took 26 days. On the other hand, India took just 11. And we're still not testing those many people. Cases are up by 105% of the first wave peak, but the tests are only up to 22%. 13.8 lakh tests were conducted in the last 24 hours. Let's also take a look at the R factor, which indicates the reproduction rate of the infection. It is the highest that it has been in the last 1 year. On the 21st of April last year, the R factor was 1.38 with over 15,000 active cases. On Thursday, it was almost 1.37 with almost 15 lakh active cases in the country. Let's also look at the number of active cases. The last 1 million cases have been added in just the last 19 days. The first million cases took 231 days. So essentially what this points out is that the current wave of COVID-19, the second wave as we're calling it here in India, is seeing a much more transmissible, a much more rapidly spreading variant of the COVID-19. Now, amid the COVID-19 surge, the Union Home Ministry has announced new rules and regulations for central government employees. There will be staggered office timings and online meetings via video conferencing. Physical attendance will be limited to 50% of the total strength. These curbs have been put in place for entry of outsiders or visitors as well. Strict instructions have been given to all employees above the age of 45 years to get themselves vaccinated. Crowding in lifts and staircases as well as corridors and common areas is to be strictly avoided. Now, 100 new hospitals will get their own oxygen plants with funds from the PM CARES Fund. This is what the government has said on Thursday amid a surge in COVID cases. The supplies of oxygen, remember, are running short in several parts of the country. In several states, we are carrying stories of how oxygen is in short supply. But the government has said that India is producing oxygen at full capacity for each of the last 2 days, and it has also boosted output. Another 50,000 metric tons of medical oxygen is also going to be imported, according to the government. Now, let's shift our focus to Delhi, which has reported 16,699 new cases in the last 24 hours. 112 patients have lost their life to COVID in this time period. This is the highest since the 23rd of November. Now, here's the worrying development. Delhi's positivity rate has crossed the 20% mark in the last 24 hours. This is the highest since June. The number of active cases is also the highest ever that Delhi has seen. There are 54,000 people who currently are infected with COVID in the national capital. This according to official estimates. Now, the Delhi government on Thursday has announced a weekend curfew to break the chain of transmission as it tackles this steep rise in COVID cases. Auditoriums, restaurants, malls, gyms and spas will all stay shut till the end of the month. Eating out has been banned once again. Only home deliveries and takeaways will be allowed.
As the national capital recorded its highest single-day surge in COVID cases on Wednesday, Delhi Chief Minister Arvind Kejriwal has announced weekend curfew in Delhi to break the chain of transmission.
सबने मिलके ये निर्णय लिए हैं कि वीकेंड के ऊपर कर्फ्यू दिल्ली के अंदर लगाया जाएगा। लेकिन वीकेंड में अक्सर जो लोग निकलते हैं वो अपने एंटरटेनमेंट के लिए या दूसरी एक्टिविटीज़ के लिए निकलते हैं, जो कि कर्टेल की जा सकती है, जो कि चेन तोड़ने के लिए वीकेंड के ऊपर, ताकि लोग ज्यादा संपर्क में ना आए, वीकेंड के ऊपर कर्फ्यू लगाया जा रहा है। लेकिन
not calling it a lockdown but only restrictions, the chief minister announced what all will be shut or be partially open. The weekend lockdown will be from Friday 10 p.m. to Monday 5 a.m. Malls, gyms and swimming pools will be closed. No dining in restaurants, only deliveries. There will be curfew passes for weddings. Cinemas can operate at 30% occupancy. Essential services are exempt from weekend curfew, and only one weekend market per day in one zone.
Have to break the chain, and this is now spreading like a wildfire, because these curfews, of course, weekend there is a rush, so there is a more chances of spread. I think that is the theory behind having only the weekend curfew. Of course, it will have some impact.
there's a mixed response from the public.
It was necessary also to have a lockdown like that. Doing it on weekend mostly offices are closed. So mainly it is for the markets and other malls and all.
बंगाल में नहीं हो रहे हैं, वहाँ भी हो रहे हैं, वहाँ पहले करो, वहाँ रैली जुटा रहे हैं, वहाँ भीड़ जुटा रहे हैं, भीड़ में कोरोना एक भी होगा तो चारों तरफ विस्फोट होगा, वहाँ नहीं हो रहा है, पूरा मार्केट के तहस नहस कर दिए हैं, छोटे मोटे जो हैं व्यापारी सब भाग रहे हैं गाँव।
After Maharashtra, the national capital has also announced curfew to tackle steep rise in COVID cases. While people in these states agree with the need for such restrictions to fight the pandemic, they also question the unabated political rallies in West Bengal and also religious gatherings in other states. With camera person Sasikanja, this is Arvind Kejriwal for NDTV.
NDTV spoke exclusively with the Delhi Chief Minister Arvind Kejriwal, where he's clarified that he doesn't believe in lockdowns, but at this moment believes that there is no option. He also said that the weekend curfew currently is for this weekend only, but can be extended if cases don't come under control. Listen in.
मैं लॉकडाउन के सख्त खिलाफ हूं।
अच्छा,
मैं रेस्ट्रिक्शंस के सख्त खिलाफ हूं। ये मैं पब्लिकली कई प्लेटफॉर्म से बोल चुका हूं। जब भी आप ये एसेस करते हैं कि कोरोना बहुत तेजी से बढ़ रहा है और आपका हेल्थ इंफ्रास्ट्रक्चर उस तेजी से उसको हो सकता है संभाल ना पाए, तो आपको टेम्पररी बेसिस पे लॉकडाउन और रेस्ट्रिक्शंस लगा देने चाहिए ताकि कोरोना की स्पीड कम हो जाए, लोग अपने अपने घर में चले जाएं, कोरोना की इन्फेक्शन होने वालों की स्पीड कम हो जाए और आप अपने हेल्थ इंफ्रास्ट्रक्चर को संभाल सकें।
Well, let's now shift our focus to the worst hit state of Maharashtra, which has seen over 61,600 new cases in the last 24 hours. 349 COVID deaths have also been reported in the state on Thursday. Pune continues to remain the worst hit with close to 10,000 daily cases and 59 deaths. Mumbai is also reporting over 8,000 cases and 50 deaths in the last 24 hours. Nasik, Thane are also two of the worst hit areas in the state of Maharashtra. Now let's just shift our focus to how Mumbai is dealing with this rise in COVID-19 infections. Mumbai hospitals will now be using luxury hotels to treat COVID-19 patients who have a milder infection. The city's administration on Thursday has done this in a bid to ramp up its facilities and infrastructure for COVID-19 patients. Cases are rising and the administration has decided to turn private hospitals into dedicated COVID facilities for advanced critical care.
Several hospitals like Hinduja Hospital are already running dedicated COVID facilities outside the hospital.
We have added 15 more beds. Then we are also running a 65-bedded DCHC in Khar area, which is managed by our doctors and nurses. So with this, we are trying to join hands with BMC to support in this endeavor.
Mumbai's private hospitals, like for example the Bombay Hospital, is seeing a huge rush because COVID patients prefer to get admitted in these hospitals. To ensure that these hospitals can cater to more people, the BMC has now started linking hotels with these hospitals. For example, patients here who do not need critical care but only need supervision and some amount of hospital care can be shifted to hotels which will be manned by staff from these hospitals.
Hospitals can charge up to 4,000 rupees for these facilities and 6,000 rupees for a room if anyone is staying with the patient. COVID positive people who are asymptomatic can also use these hotels.
Patients from Bombay Hospital in South Mumbai who do not need critical hospital care will be shifted to the Intercontinental Hotel here on Marine Drive. The BMC says this will allow hospitals to create more beds and look after more patients. So Bombay Hospital in South Mumbai has been linked to the Intercontinental Hotel on Marine Drive in South Mumbai itself.
To manage the load, the civic body has decided that Jaslok Hospital will function as a dedicated COVID facility for advanced critical care. Municipal Commissioner I.S. Chahal has announced an additional 250 COVID beds are being added to BMC dashboard, including 40 ICU beds from Saturday morning to help needy citizens. and the arrangement with hotels will help increase the number of beds as well. In Mumbai with camera person Sanjay Mandal, Saurabh Gupta, Joshua Chin for NDTV.
Well, as cases spike in Rajasthan, a weekend curfew has also been announced now. The curfew starts this evening at 6 p.m. and will continue until Monday morning, 5 a.m. Harsha joins us with the very latest. Harsha, what more can you tell us about this latest decision?
Well, obviously, the growing numbers is what's really, I think, worrying the state government. So you've noticed this since this week, they've kind of come down with some pretty strict curbs. And this was a late-night decision that took everybody by surprise. In fact, the Chief Minister tweeted about it. So there's not even an official order out yet on that. But the Chief Minister informed everyone through a tweet that, this weekend curfew would come into effect. There have been 6,600 cases, 33 deaths. And, across districts, we have 33 districts in Rajasthan, but across 19 of those districts, they're reporting more than 100 cases. So that's definitely worrying. The number of deaths is also worrying because the recovery rate is going down. And the positivity rate, of course, has gone up. It's gone up to almost to 14 to 15%, which is quite high. So far, health infrastructure is coping, but clearly it's not going to be able to cope if the numbers keep increasing like this. So to break the chain, this kind of a decision has been taken, though, of course, it's more about public participation because we noticed that very strict enforcement is not being done in Rajasthan. But it's more about appealing to the public participation. And, of course, essential supplies will be exempt. So fruits, vegetables, milk, your LPG cylinders, banking services, and people who are going either to railway stations or to bus stands, they will be exempt from this, as will weddings. So that is the overall scenario in Rajasthan. And looking at a weekend curfew, we will start seeing how actually people react and how much people participation is going to take place. That really will be key.
All right, Harsha, appreciate you for joining us with the very latest. We'll keep a close watch on all those developments from Rajasthan. Varying degrees of restrictions there being put in place across different parts of the country. A weekend curfew now in Rajasthan is the latest. Let's shift our focus now to Kerala, which has decided to do mass testing with a target of 2 lakh to 2.5 lakh cumulatively for Friday and Saturday. People who are a part of the election process, transport sector, hospitality sector, tourism sector, delivery agents, shops, hotels, COVID frontline workers, those living in COVID-affected areas are all those who can, in fact, participate in this mass testing exercise. Well, with that, we're slipping into a very short break. We'll be back with more on the other side. Stay with us. Welcome back. The Election Commission has called for an all-important meeting to decide on how to maintain COVID protocol in the middle of campaigning. Meanwhile, remember, Union Home Minister Amit Shah is in West Bengal. The BJP President JP Nadda too has a campaign schedule laid out for him, as does the West Bengal Chief Minister Mamata Banerjee, who continues to campaign in the state, although she's now said that she's ready for the clubbing of polls. Well, Monideepa joins us with the very latest. All right, we'll try and reconnect with Monideepa. We seem to have lost that line with her, but this is the big story that we're tracking. The Election Commission has now called for an all-party meeting to decide on how to best maintain COVID protocols in the middle of campaigning. Remember, as India's coronavirus infections continue to rise, there have been large gatherings, roadshows, rallies that have continued unabated in the state of West Bengal. This has also led to a rise in COVID-19 infections in the state that we've been reporting on. Meanwhile, even as the Election Commission has taken stock of this and called for an all-party meeting today, the Union Home Minister, the BJP President and the West Bengal Chief Minister Mamata Banerjee all continue their campaign in the state. Now, while of course the Election Commission is going to be deliberating on how to follow COVID-19 protocols while electioneering, the Union Home Ministry has announced its own set of rules and regulations for central government employees. There will be staggered office timings, online meetings, video conferencing, physical attendance in government offices, central government offices, is now going to be restricted to 50% of the total strength. These are strict instructions that have now been put in place, and employees above the age of 45 have also been asked to go get themselves vaccinated. Neeta, who's been tracking the details of this story, joins us. Neeta, it's interesting to see that on the one hand, you have political campaigning continuing in West Bengal in full force. And on the other hand, now all central government employees are going to be subjected to a whole host of rules and regulations in order to ensure that COVID-appropriate behavior and protocols are followed.
Yes, Rishika, in view of unprecedented rise in numbers of coronavirus, especially in Delhi, this decision has been taken. Various ministries have come out with rules and regulations for various ministries. As far as Ministry of Home Affairs is concerned, they have said the staggered timings are going to continue and only attendance up to 50% is now allowed. Outsiders are also not welcome in North Block or in various ministries of various officers of Ministry of Home Affairs also. All officers who will attend office can also stagger their timing with entry into office spread from 9 a.m. to 10 a.m. Earlier if you have to get in the North Block, the in timings were about 9 o'clock, but now they have been staggered. This has been allowed, so that people don't crowd near staircases, people don't crowd near lifts and all. There have been numerous cases, especially in North Block. Many officers have come down with COVID-19. That is why these instructions have been, have been laid out by the Ministry of Home Affairs. The curbs have also been put on outsiders, as I was mentioning. Corridors, common areas, including refreshments, parking areas are to be strictly avoided. Crowding is to be strictly avoided in these areas. So these instructions are going to be laid in place. They are going to come in force from today itself, and they are going to continue to remain in force till April 30th, 2021. Rishika?
All right, so a whole host of restrictions there being put in place as far as central government offices are concerned. Work from home has also been implemented across different sections. Appreciate you, Neeta, for joining us for the very latest. We'll keep a close watch on all those developments. We're going to slip into a very short break. We'll be back with more news on the other side. Stay with us. Welcome back. At NDTV, we believe in bringing you the solutions. Amid the spike in coronavirus infections in Delhi, we spoke exclusively to the Delhi Chief Minister Arvind Kejriwal. Here's what he said about lockdowns.
There is a massive surge, Mr. Kejriwal, we are aware. Can you, we have to start by reinstalling that confidence to all those who are going to hospitals and seeing the condition out there. Can you with utmost confidence assure the people of this city that you will have this situation under control and that we are prepared?
संकेत मैं ये एश्योर कर सकता हूं कि जो भी स्थिति होगी जनता के सामने सारी स्थिति ईमानदारी के साथ रखूंगा। कोई भी इस दुनिया के अंदर जो ये महामारी है और जिस स्केल की महामारी है, कोई भी ये एश्योर नहीं कर पाएगा कि स्थिति हमेशा के लिए कंट्रोल में रहेगी कि नहीं रहेगी। एक सबसे बड़ी बात दिल्ली सरकार में ये है कि हम कोई भी चीज छुपा नहीं रहे हैं। हमारा डेटा, चाहे वो डेथ का डेटा हो, चाहे वो टेस्टिंग, हम एक्स्ट्राऑर्डिनरी लेवल्स की टेस्टिंग करा रहे हैं। हमारे कितने केसेस आ रहे हैं, कितने बेड खाली हैं, कितने बेड भर गए हैं, ऑक्सीजन कितनी अवेलेबल है, दवाई कितनी अवेलेबल है, सब चीजें जनता के सामने रख रहे हैं। और जब सारी चीजें जनता के सामने रखेंगे तो अगर कोई क्राइसिस भी आती है तो जनता से ही सहयोग मांगेंगे, सारे लोगों से सहयोग मांगेंगे। तो ऑल दैट आई कैन एश्योर इज कि हर चीज आपके सामने ईमानदारी के साथ रखी जाएगी और हर रोज और या हर ऑल्टरनेट डे मैं आके जनता से सीधे बात करता हूं और उनको स्थिति के बारे में बताता हूं। तो आज की स्थिति में आपको बता देता हूं कि अभी फिलहाल दिल्ली के अंदर बेड्स की कमी नहीं है। लगभग 4,500 से 5,000 बेड्स अवेलेबल हैं दिल्ली के अंदर। 500 के करीब अभी आईसीयू अवेलेबल हैं दिल्ली के अंदर और हमने एक ऐप बनाया है जिसमें जहां जाके आप क्लिक करके देख सकते हैं कि किस अस्पताल के अंदर कितने बेड अवेलेबल हैं और कितने आईसीयू बेड्स अवेलेबल हैं। तो 5000 बेड्स अवेलेबल हैं। मेरी आपके चैनल के माध्यम से सभी लोगों से एक रिक्वेस्ट है। मेरे पास कई लोग आते हैं, कोई कहेगा जी मेरे को मैक्स में करा दो, मेरे को अपोलो में करा दो, मुझे गंगाराम में करा दो, मुझे फोर्टिस में। ये रिक्वेस्ट थोड़ी मुश्किल हो जाती हैं। कुछ अस्पताल ऐसे हैं जिसमें बेड खत्म हो गए हैं, लेकिन इसका मतलब ये नहीं कि दिल्ली में बेड खत्म हो गए हैं। आप सब लोगों को ये समझना पड़ेगा, ये बहुत बड़ी महामारी है। मैं आपको इस वक्त बेड एश्योर कर सकता हूं, अच्छा इलाज एश्योर कर सकता हूं, लेकिन आप कहो मुझे इसी अस्पताल में बेड चाहिए, वो एश्योर नहीं कर सकता। आपको अच्छा इलाज मिलेगा, अच्छा बेड मिलेगा, चाहे सरकारी में मिले चाहे प्राइवेट में मिले, चाहे प्राइवेट में किस अस्पताल में मिले, सरकारी में, वो प्लीज आप इतना चूजी मत होइए। अभी इस वक्त हमारे लिए सबसे इंपॉर्टेंट जान बचाना है।
अरविंद जी, दिल्ली की सड़कों पे घूमते हुए जो लोग सवाल पूछते हैं और आपसे भी पूछते होंगे प्राइवेट में, हर दूसरा बंदा यही सवाल पूछ रहा है कि क्या दिल्ली में लॉकडाउन लगेगा? तो आप इसका जवाब दे दीजिए, क्या लॉकडाउन लगेगा? हर बंदा यही सवाल पूछ रहा है, हर किसी की जुबान पर यही है कि क्या लॉकडाउन लगेगा।
मैंने इसका अभी आपको क्लियरली जवाब दिया कि हम कोशिश कर रहे हैं कि दिल्ली के अंदर मेडिकल हेल्थ का जो इंफ्रास्ट्रक्चर है, स्पेशली बेड्स हैं, हमने संकेत पूरी दुनिया के अंदर कई सारे ऐसे विजुअल्स देखे हैं जब अस्पतालों के बाहर पेशेंट्स लाइनों में लगे पड़े हैं और कॉरिडोर्स के अंदर पेशेंट्स पड़े हुए हैं, उनको बेड नहीं मिल रहे, ऑक्सीजन नहीं मिल रही। अगर ऐसी स्थिति आती है तो डेथ बहुत ज्यादा बढ़ जाती है, क्योंकि उनको मेडिकल सुविधा नहीं मिल पाती। ये स्थिति हम दिल्ली में नहीं चाहते किसी भी हालत में। तो अगर हमें ये लगने लगेगा किसी भी वक्त कि हमारा बेड्स जो है वो हम वी आर नॉट एबल टू कीप पेस विद इट, अगर हमें लगने लगा गया कि मेडिकल हेल्थ इंफ्रास्ट्रक्चर जो है वो कम पड़ता जा रहा है, तो उस वक्त हमें हो सकता है कि लॉकडाउन लगाना पड़े। आज की डेट में ऐसी स्थिति मुझे आते हुए नजर नहीं आ रही, बिकॉज अभी हम जिस तरह से नंबर ऑफ बेड्स बढ़ाते जा रहे हैं, अगले ही कुछ दिनों के अंदर हम और भी काफी बढ़ा रहे हैं। हमने केंद्र सरकार से भी आज मदद मांगी है। सुबह सुबह मेरी एलजी साहब से जो मीटिंग हुई थी, मैंने उनसे ये रिक्वेस्ट किया था, ऑनरेबल एलजी ऑफ दिल्ली, ही इज आल्सो गोइंग टू स्पीक टू द सेंट्रल गवर्नमेंट की सेंट्रल गवर्नमेंट भी इसमें मदद करे। वो कर भी रहे हैं, सेंट्रल गवर्नमेंट भी मदद कर रही है। तो हम कोशिश कर रहे हैं कि ज्यादा से ज्यादा इसकी कैपेसिटी को बहुत तेजी से बढ़ा सकें। आज की डेट में मेरे को नहीं लग रहा कि हम लॉकडाउन लगा रहे हैं।
Welcome back. Let's shift our focus now to Uttar Pradesh. Now, this is a state that continues to remain a huge cause of concern. The state has crossed over 1 lakh active cases. Lucknow continues to remain the worst affected, and markets in Lucknow have gone into a self-imposed lockdown, unheard of really. Meanwhile, Prime Minister Modi's Lok Sabha seat, which is Varanasi, the Uttar Pradesh government has announced an extended night curfew, and the DM of Varanasi has urged tourists to stay away from the city till the end of the month.
As Lucknow's COVID cases surged to record highs, a cover-up less than 24 hours after this horrifying video from Lucknow's main COVID crematorium. This is Lucknow's main COVID crematorium, from where those images have gone viral. While no on-record version is available about why it has been done, there's a notice there that says that this is a COVID-19 affected area and one cannot enter without permission, and that anyone who enters this area without permission, there will be legal action against that person. Lucknow now has 31,000 plus active COVID cases. Just 2 weeks ago, active cases were at 1/10 of this number. In the city's major markets, an unprecedented self-imposed lockdown for the next few days by trader associations. So why is this situation unprecedented? One reason is that this shutdown of markets by Lucknow traders goes against the stated UP government policy, where they've decided not to impose any day lockdown despite the COVID surge in UP, because they say that it will lead to economic distress.
The employees working with the shopkeepers and the shopkeepers at large had a feeling that we as a citizen should also do something, because this pandemic has spurred in a very rapid way in last couple of days. Everyone suggested that at least we should curb on the active marketing activities.
In Kanpur, where active COVID cases have gone up 1500% in 2 weeks to 6,447, this desperate daughter, unable to find a bed for her ailing mother at the government COVID hospital.
यहाँ पे पहले यहाँ हो जाएगा लेटर दिखाइए, अगर आपके पास नहीं तो आप सीधे बोलिए कि मेरे पास जगह नहीं है, आप लेटर का मतलब नहीं बनता ना, फिर लेटर दिखाइए, पहले आपको लेटर मंगवाया, लेटर दिखाया, अब जगह नहीं है यहाँ पे, कहीं भी बेड नहीं है, कहीं भी बेड नहीं है, हम कह रहे बेड नहीं है, अरे बाहर में जाए बेड, कम से कम जमीन में लगा के बिस्तर लगा के पेशेंट को ट्रीटमेंट तो दीजिए। यहाँ एक केस नहीं है, बहुत सारे केस ऐसे लोग रोड पे घूम रहे हैं ले लेके अपने पेरेंट्स को अपने।
In Prime Minister Modi's Lok Sabha constituency Varanasi, where active COVID cases crossed 10,000 on Wednesday from just 550 2 weeks ago, this appeal by the district magistrate asking visitors, both domestic and foreign, to avoid coming to the city till April end. Entry to the city's most famous religious site, the Kashi Vishwanath temple, will be allowed only after a COVID negative report. With Arun Agarwal and camera person Rajesh Gupta, this is Alok Pandey, NDTV.
Well, from crematoriums to burial sites in Delhi and to those in Karnataka and Bengaluru, graveyards are overburdened. Spare minute for those who work there, seeing bodies piling up every single day and risking their lives in the bargain as well. Add to that, some of them haven't even received their salaries.
Anthony, in his over 45-year career as a gravedigger, has never seen bodies being brought in with this frequency. Bengaluru has seen over 400 deaths due to COVID in the last month alone. The COVID pandemic has made the work of the 65-year-old more stressful, with a need for precautions with the bodies of those who died of COVID. But Anthony, like many of his colleagues in the profession, says he has not been paid for over a year.
सब बॉडियों हक से ज़्यादा आ रहा है सब, ये बोल नहीं सकता कि आजकल कब क्या होगा पता नहीं। मुझे भी कोविड इफेक्ट हुआ था, मैं भी 3 महीना हॉस्पिटल में पड़ा था। गवर्नमेंट बीबीएमपी की तरफ से एक बूंद भी मदद नहीं मिला हमें। सैलरी कम से कम 13 साल से नहीं मिल रहा है सर, 13 महीने से नहीं मिल रहा है। तो हम क्या करें, बच्चों का फीस कैसे भरें, इलेक्ट्रिक बिल कैसे भरें, पानी बिल कैसे भरें, सब कुछ खरीदना पड़ता है।
कोरोना के समय उनके परिवार खुद अपनी बॉडी को, जो साथ में उनके पिता हो भाई हो, उनको हाथ नहीं लगा रहता है। यही बंदा लोग सर दिन रात रह के उनकी काम किया, उन्होंने उठाया, जो पूजा करना कर्म किया वो काम किया। अभी तक इनको धन का 1 पैसा भी नहीं मिल रहा।
Over 13,000 people have died due to COVID so far in Karnataka, with Bengaluru seeing almost 5,000 deaths. Karnataka's case fatality rate is now around 0.33%. But with the high number of cases, the number of deaths in real terms does of course rise. The government says the salary issue will be addressed as soon as possible.
बैरल ग्राउंड में कोई बॉडीज को बर्न करते ना, वो लोग के बारे में पेमेंट अभी 7 महीने से नहीं आया। इसलिए मैं बीबीएमपी कमिश्नर को भी और सीनियर मोस्ट ऑफिसर गौरव गुप्ता की भी बात किया, वो लोग बोलते हैं श्री राम ले ले पॉसिबल हम क्लियर करेंगे।
Karnataka's second surge of COVID-19, a time of stress for patients, their families, and for many others too. With Govind Murthy, Maya Sharma in Bengaluru for NDTV.
Welcome back. India on Thursday crossed the grim milestone of over 2 lakh daily coronavirus cases, the highest ever in the country in 24 hours. The 2 lakh cases on Thursday is double of what India saw in the first peak. Now, from 1 lakh to 2 lakh cases, the United States, which is the worst hit country, has taken 26 days. India took just 11. And we're not testing that much. Cases are up 105% off the first wave peak, but tests are up only 22%. 13.8 lakh tests were conducted in India in the last 24 hours. Let's take a look at the R factor, which indicates the reproduction rate of the infection. It is the highest that it's been in a year. On the 21st of April last year, the R factor was 1.38 with 15,000 active cases. On Thursday, it was 1.37 with almost 15 lakh active cases. And Dr. Guleria is in fact speaking at the All India Institute of Medical Sciences. Let's dip in and listen in.
Okay. Any other thing, any other issue that anyone wants to bring up in terms of problems that we're having?
Morning, sir. We're getting a surge of pregnant women who are positive. So once they come to us, there are maybe a couple of weeks left, they are with us. And then after delivery or surgery, they get back, they are with us for another 5 to 7 days. So that decreases our turnover time. So if we could have a dedicated maternity facility around this place, which caters to only positive pregnant women.
We did that last time. Maybe we can look at that. Last time we had created a facility.
Yes, sir.
So there were two parts of it. One was normal delivery, the other was cesarean section.
Yes, sir.
And then there was a COVID suspect and a COVID positive.
Yes, sir.
Cesarean was being done for COVID positive in the trauma center.
Yes, sir.
And gynae department had created an area. I think it was on 3rd floor,
yes,
if I'm not mistaken.
But the issue is, sir, a lot of positive unbooked pregnant women are coming, which are fine. But it just, once they are with us after cesarean sections, and it's a perfect normal cesarean with a neonate, the bed is occupied for about 5 to 7 days. So that is, I'm just putting across that we could utilize that bed in a better way if there was a dedicated place where after cesarean they could go, because they
are positive, they will have to stay.
They are positive. That's so what I said. A dedicated maternity like a women's
trauma
hospital.
center mein banana padega na.
ठीक है सर, वो देखो.
One option is that we could send them to NCI Jhajjar because they are otherwise stable.
Yes, sir, they are totally stable.
But they are post-operative.
They are post-operative. Neonates भी हैं सर साथ.
So let's see what Dr. Sunesh has, if he has any idea.
Thank you, sir. So we have made 3 teams of faculty and seniors, and one team for a week's time exclusively look after patients who are in trauma center.
COVID positive, pregnant women.
Those who need cesarean, they is done by this team there in coordination with our NSA colleagues. Of late now we are finding some patient 32 weeks, 34 weeks. She turns out to be positive, but she is yet away from the delivery. So we have been talking to patient in last 5 days. At least 60% said he will.
All right, so that's of course a live feed that's coming in from the All India Institute of Medical Sciences. Dr. Guleria addressing concerns of doctors. Union Health Minister Dr. Harshvardhan is also present there to take stock of this situation. We'll continue to keep a close watch on India's COVID story. Meanwhile, amid the surge in cases, the Union Home Ministry has announced new rules for central government employees. There will be staggered office timings and online meetings via video conferencing that will be taking place once again. Physical attendance in the office is going to be restricted to 50% of the overall strength. Curbs have been put in place for entry of outsiders, and strict instructions have been given to all employees above the age of 45 years to go get themselves vaccinated. Crowding at lifts, staircases, corridors and common areas is to be strictly avoided. 100 new hospitals will now get their own oxygen plants with funds from the PM Cares Fund. This is what the government said on Thursday amid the surge in cases. The supply of oxygen, remember, is running short in several states, but the government has said that India is producing oxygen at full capacity for each of the last 2 days and has boosted output. Another 50,000 metric tons of medical oxygen is going to be imported, said the government. Moving on, let's get you up to speed with what's happening in the national capital. Over 16,600 new cases in the last 24 hours. 112 patients have lost their lives to COVID-19. This is the highest since the 23rd of November. Now, the worrying story here is that Delhi's positivity rate has crossed 20% in the last 24 hours. This is the highest since June. The number of active cases in Delhi has crossed 54,000, which is also the highest ever. My colleague Sonakshi Chakrabarti, tracking the details of the story, is joining us with the very latest. Sonakshi, you know, Delhi is bracing for a weekend lockdown that's going to be in place from this evening. What are you seeing on the ground? And more importantly, how worried should we be about this positivity rate in the national capital breaching 20%?
Well, like you rightly pointed out, Rishika, that the fact that the positivity rate of the national capital has breached a 20% mark is in fact going to be very worrying in the days to come, given that the surge in infections and cases has only seen a rise in the national capital. Now, just yesterday, the national capital reported over 16,000 cases, which is about 1,000 less to the previous day, which is day before yesterday's record number of over 17,000 cases. If I can just give you a brief look at a market where I'm standing right now. Usually this market starts filling up with cars and shopkeepers coming in, and a lot of people really just starting to gather at the market. But if I can just give you a brief look, it is absolutely empty. Well, it's also because it's just the day is just gearing up, but then it is around this time when people really start coming into the market as well. So if I can also give you a sense of what markets will look like, this is exactly what the national capital will look like, especially the markets, because the national capital will be experiencing a weekend curfew as announced by the Chief Minister yesterday, given in the light of a surge in the number of cases and the surge in infection. Now, what is key for all of us to remember and for our viewers to know is people movement will be monitored. That is very essential. People cannot be under the impression that they can just step out of their houses with no motive. They will be monitored and they could be checked at any point in the national capital as to why they are going about from places. But of course, essential services will not be impacted. That goes without saying. And of course, curfew passes will be issued. But what is key to remember for all of us at this point is that the national capital is seeing a worrying trend in the cases, which is why just a short while ago the Union Health Minister has visited AIIMS, the top hospital, to take stock of the situation and to take stock of the fact that the medical facilities are gasping for all kinds of shortages at the moment.
All right, appreciate you, Sonakshi, for joining us with the very latest. So that, of course, is the picture of a marketplace in Delhi wearing a rather deserted look, but it's only 9 a.m. Markets will open up in just a short while from now. The curfew, remember, comes into place only later this evening. Let's now shift our focus to Maharashtra, the worst hit state as far as COVID-19 is concerned. 61,695 new cases have been reported in the last 24 hours. 349 COVID deaths have also been reported in this period. Pune continues to remain the worst hit with close to 10,000 cases in 24 hours and 59 deaths. Mumbai too has seen over 8,000 cases and 50 deaths. Nasik, Nagpur and Thane are other worst hit districts in the state of Maharashtra. The Maharashtra Chief Minister Uddhav Thackeray has tweeted to say that the Department of Science and Technology, Government of India, has granted approval for the Hafkin Institute to produce Bharat Biotech's Covaxin on a transfer of technology basis. The Chief Minister has thanked the Prime Minister for approving this request. How soon can manufacturing be underway, of course, is the big question. Saurabh joins us with the very latest from Maharashtra at the moment. Saurabh, Maharashtra continues to remain the worst hit. As far as Mumbai is concerned, there are several hotels now that are turning into COVID quarantine facilities for patients with mild COVID. Several hospitals now exclusively being reserved to fight COVID-19.
Yes, I mean, the administration is doing all it can to accommodate the large number of patients. And like you said, those hotels that are being turned into places where COVID patients can be treated are being described as step-down facilities by the, Brihan Mumbai Municipal Corporation, the BMC as we call it. Now, apart from that, this Covaxin, sort of production in Maharashtra is something that Maharashtra had been pushing for. In fact, this has been in the plan since the vaccination process started. The Hafkin Institute has the sort of wherewithal to sort of do this, and Maharashtra, as you know, went through a massive shortage of vaccines, and this will really help Maharashtra scale up its vaccination process. That's something that it's been trying to do, but has been held back because there simply isn't enough doses to go around to scale it up to the amount that it wants to. So that's something that's going to happen. In fact, the Chief Minister Uddhav Thackeray tweeted to the Prime Minister for, thanking him for this approval to allow Hafkin Institute to sort of produce the Covaxin, which is one of the Bharat Biotech's Covaxin, the product which is used for vaccination in COVID, in prevention of COVID. And Aditya Thackeray, also the minister, has tweeted about it as well, saying that he thanks the Chief Minister for pursuing this with the centre, and thanks the Prime Minister for approving this request. But this is something that will help a long way in Maharashtra's long-term strategy against COVID. Remember, these restrictions that are in place are only there for 15 days. Maharashtra has to plan ahead. This is the economic powerhouse of the country. People have to go to work here. It's an extremely crowded city. So vaccinations are the only answer, and this will probably help ramp up vaccinations.
Right, Saurabh, appreciate you for joining us for the very latest. Short break here. On the other side, we'll have a panel of expert doctors joining us. We'll talk about India's current COVID crisis. Welcome back. India is in the midst of a deadly second wave of COVID-19. What are the do's and don'ts? What should be the protocols that you should be following? Let's introduce our panel of expert doctors to talk about what's happening in the country currently. We have Dr. Preeti Sharma, pulmonologist from Mohali, joining us at the moment. We have Dr. Ram Babu, Senior Consultant Internal Medicine, Jaipur Golden Hospital, Delhi, and Dr. Nitin Tiwari, Senior Cardiologist from the Wockhardt Hospital in Nagpur. Thanks so much, doctors, for being with us. Dr. Preeti Sharma, if I can begin by asking you at the moment, we are in the midst of the second wave. It is definitely, we're definitely seeing much more number of cases on a daily basis than we were. India breached the 2 lakh cases mark on Thursday. What is the situation on the ground currently? One of the big questions that a lot of our viewers is asking is, should they manage COVID at home if it's mild, or should they still be seeking quarantine or a hospital bed?
Yeah, we have different kinds of cases. If you have very mild symptoms like fever, which is manageable at home, and we keep on monitoring the pulse oximetry, that is the saturation levels of the oxygen, which we are always provided the kit by the government itself. So we can keep that monitoring. If saturation falls below 94%, then we need to report to the hospital. In case you are able to maintain your oxygen saturation levels and you are controlling your fever with the basic medications, with the prescription of the doctor, then we can always manage ourselves at home. But whenever you feel that you are really breathless and you have some kind of alarming signs, that is, you are feeling breathlessness, you have very high grade fever, your saturation oxygen levels are falling below 94%, yes, then you immediately need to report to the hospital.
All right. So these are all critical markers that one must keep in mind in order to understand when you can manage COVID at home and when you must absolutely seek hospital admission and you need critical care. I want to go across to Dr. Tiwari. Dr. Tiwari, you're joining us from Nagpur, which is one of the worst hit districts in the country. Nagpur has seen an exponential rise in daily COVID cases. How is this second wave of COVID different from what you saw in the first wave? There is a double mutation that is spreading rapidly. There's also the UK variant now that's spreading rapidly across several districts.
Yeah, thank you. See, this wave is more dangerous, it is more infective, and partly around hardly maybe a single percent, maybe hardly 5-7% is because of variants, but mainly it's because of negligence, I will say. And the patients who are presenting this time have directly, the lung is getting directly involved. Like in the previous surge, the nasal passages were infected, and then eventually subsequently in a few days, the lungs were getting involved. But in this, directly the lungs are involved. This is more critical. More patients are getting serious. And I believe COVID is a very, very dangerous virus, and it can adapt itself. It can mutate itself and change itself to the situation. But unfortunately, the people are not changing according to the situation. And that is why this surge. People say it is because of variant, but I say it is because of indifferent behavior. We are not learning from the previous curve. We are not learning from it. Like if John F. Kennedy has said, it's not what the nation does for you, it's what you can do for the nation.
Dr. Tiwari,
so
there is also evidence. There is also evidence now scientific data that has been made available. Senior sources within the health ministry have also told NDTV about the presence of the double mutation, a more rapidly spreading strain. We're also seeing that correlation in terms of the R effect that is currently being seen in India. Dr. Preeti Sharma, would you agree that it's perhaps a combination of both? The fact that people let their guard down when cases dipped, as well as the fact that what we are seeing, is a more dangerous, a more rapidly spreading variant of COVID in India?
See, actually, it is a combination of both. Because people have neglected things out and they have stopped wearing masks. All the crowd gatherings are being done. People are partying. People are doing everything. So people have neglected so much, and this variant is again so much of infectivity is there. Initially, 1 in 4 persons were infected. By this variant, almost 1 in 8 persons are immediately getting affected. So it's a combination of both the things. Since it has been a long time, so people have just found that there's nothing like COVID and nothing like that. They don't.
Dr. Preeti, yes, Dr. Preeti, if I can just ask you, according to what sources in the health ministry have told NDTV, the UK variant is predominantly spreading in Punjab. Are you seeing, therefore, very different characteristics, symptoms, clinical dispositions of patients in this wave, given the fact that we know that the UK variant is largely responsible for the spike in Punjab versus what you saw last time?
Yeah, we have seen a different kind of presentation of the patients, and here the patients have a lot of lung involvement. Every single patient who has been hospitalized has some kind of, either it is a mild grade, moderate grade or very severe grade. And many patients are taking too long. Their oxygen requirements are not going down. The hospitals are full. We are running short of things, and it's really very serious situation at this point of time.
I want to understand a little bit. Both the doctors have spoken about increased lung involvement as far as this new variant that's spreading is concerned. Dr. Ram Babu is joining us from Delhi. Dr. Babu, what's your assessment as far as lung involvement is concerned? What do you really mean when you say there's increased lung involvement as far as this new wave is concerned?
Good morning, Sonakshi and everyone of NDTV, and thank you for inviting. Definitely, this is the second wave of SARS-CoV. This is very dangerous, and the lung involvement is the very dangerous part of this disease. If a patient have the involvement of lung initially, then it is maybe mild, moderate, severe. If patient have mild, then there is no problem. But the moderate to severe disease has definitely have a problem. There decrease the oxygen saturation. Okay. Then initially patient can tolerate the hypoxia. That is the happy hypoxia, but that's a bit bad sign. So early detection of the disease and early diagnosis of the disease and the early intensive care is good
Dr.
for
Tiwari,
the outcome of the...
Right. Dr. Tiwari, you've also talked about increased lung involvement. What are the markers that viewers need to watch out for? If you're infected with COVID, what should you be careful about?
See, if you're infected with COVID, there are certain symptoms which we should be worried about, like incessant fever, like the patient is getting very, very much breathless.
No, I'm talking specifically, Dr. Tiwari, specifically about lung involvement. Yes.
In the lung involvement, the markers like the ferritin levels, the CRP levels in particularly, I would say, these two markers are inflammatory markers, and the damage to the lungs is not because of the virus, it is because of the damage by the cells of the body itself. So I think these are the two markers which we should always look for and get them checked. If the markers are rising, then that can be an indication for hospitalization or at least giving steroids and anticoagulation.
Very quickly, Dr. Tiwari, would you advise COVID patients who have comorbidities to get a lung X-ray or a lung CT, given the fact that you're observing this in a lot of COVID patients in this wave?
Yes, why not? If there are markers which are increased, I'll have very low threshold in getting a CT scan done. Lung X-ray is not very reliable. I mean, small things are not picked up. But a CT scan, HRCT can easily do it, and it's easily available also and quite cheap also now. So the threshold should be very less to just check whether, because that can also be a test for COVID. If the lungs are normal, then chances are less that you might be carrying COVID.
All right, I think that's a very interesting analysis of what really are some of the differentiating characteristics of these variant strains that are spreading here in India. Thank you so much, doctors, for sparing your time and being with us on NDTV. We're going to slip into a very short break. We'll be back with more news on the other side. Stay with us. Welcome back at NDTV. We believe in bringing you the solutions. We spoke with the Delhi Chief Minister Arvind Kejriwal exclusively, who clarified that he doesn't believe in lockdowns but has no option if cases don't come under control.
There is a massive surge, Mr. Kejriwal, we are aware. Can you, and we have to start by reinstalling that confidence to all those who are going to hospitals and seeing the condition out there. Can you with utmost confidence assure the people of this city that you will have this situation under control and that we are prepared?
संकेत मैं ये एश्योर कर सकता हूं कि जो भी स्थिति होगी जनता के सामने सारी स्थिति ईमानदारी के साथ रखूंगा। कोई भी इस दुनिया के अंदर जो ये महामारी है और जिस स्केल की महामारी है, कोई भी ये एश्योर नहीं कर पाएगा कि स्थिति हमेशा के लिए कंट्रोल में रहेगी कि नहीं रहेगी। एक सबसे बड़ी बात दिल्ली सरकार में ये है कि हम कोई भी चीज छुपा नहीं रहे हैं। हमारा डेटा, चाहे वो डेथ का डेटा हो, चाहे वो टेस्टिंग, हम एक्स्ट्राऑर्डिनरी लेवल्स की टेस्टिंग करा रहे हैं। हमारे कितने केसेस आ रहे हैं, कितने बेड खाली हैं, कितने बेड भर गए हैं, ऑक्सीजन कितनी अवेलेबल है, दवाई कितनी अवेलेबल है, सब चीजें जनता के सामने रख रहे हैं। और जब सारी चीजें जनता के सामने रखेंगे तो अगर कोई क्राइसिस भी आती है तो जनता से ही सहयोग मांगेंगे, सारे लोगों से सहयोग मांगेंगे। तो ऑल दैट आई कैन एश्योर इज कि हर चीज आपके सामने ईमानदारी के साथ रखी जाएगी और हर रोज और या हर ऑल्टरनेट डे मैं आके जनता से सीधे बात करता हूं और उनको स्थिति के बारे में बताता हूं। तो आज की स्थिति में आपको बता देता हूं कि अभी फिलहाल दिल्ली के अंदर बेड्स की कमी नहीं है। लगभग 4,500 से 5,000 बेड्स अवेलेबल हैं दिल्ली के अंदर। 500 के करीब अभी आईसीयू अवेलेबल हैं दिल्ली के अंदर। और हमने एक ऐप बनाया है जिसमें जहां जाके आप क्लिक करके देख सकते हैं कि किस अस्पताल के अंदर कितने बेड अवेलेबल हैं और कितने आईसीयू बेड्स अवेलेबल हैं। तो 5,000 बेड्स अवेलेबल हैं। मेरी आपके चैनल के माध्यम से सभी लोगों से एक रिक्वेस्ट है। मेरे पास कई लोग आते हैं, कोई कहेगा जी मेरे को मैक्स में करा दो, मेरे को अपोलो में करा दो, मुझे गंगाराम में करा दो, मुझे फोर्टिस में। ये रिक्वेस्ट थोड़ी मुश्किल हो जाती हैं। कुछ अस्पताल ऐसे हैं जिसमें बेड खत्म हो गए हैं, लेकिन इसका मतलब ये नहीं कि दिल्ली में बेड खत्म हो गए हैं। आप सब लोगों को ये समझना पड़ेगा, ये बहुत बड़ी महामारी है। मैं आपको इस वक्त बेड एश्योर कर सकता हूं, अच्छा इलाज एश्योर कर सकता हूं, लेकिन आप कहो मुझे इसी अस्पताल में बेड चाहिए, वो एश्योर नहीं कर सकता। आपको अच्छा इलाज मिलेगा, अच्छा बेड मिलेगा, चाहे सरकारी में मिले चाहे प्राइवेट में मिले, चाहे प्राइवेट में किस अस्पताल में मिले, सरकारी में, वो प्लीज आप इतना चूजी मत होइए। अभी इस वक्त हमारे लिए सबसे इंपॉर्टेंट जान बचाना है।
अरविंद जी, दिल्ली की सड़कों पे घूमते हुए जो लोग सवाल पूछते हैं और आपसे भी पूछते होंगे प्राइवेट में, हर दूसरा बंदा यही सवाल पूछ रहा है कि क्या दिल्ली में लॉकडाउन लगेगा? तो आप इसका जवाब दे दीजिए, क्या लॉकडाउन लगेगा? हर बंदा यही सवाल पूछ रहा है, हर किसी की जुबान पर यही है कि क्या लॉकडाउन लगेगा।
मैंने इसका अभी आपको क्लियरली जवाब दिया कि हम कोशिश कर रहे हैं कि दिल्ली के अंदर मेडिकल हेल्थ का जो इंफ्रास्ट्रक्चर है, स्पेशली बेड्स हैं। हमने संकेत पूरी दुनिया के अंदर कई सारे ऐसे विजुअल्स देखे हैं जब अस्पतालों के बाहर पेशेंट्स लाइनों में लगे पड़े हैं और कॉरिडोर्स के अंदर पेशेंट्स पड़े हुए हैं, उनको बेड नहीं मिल रहे, ऑक्सीजन नहीं मिल रही। अगर ऐसी स्थिति आती है तो डेथ बहुत ज्यादा बढ़ जाती है क्योंकि उनको मेडिकल सुविधा नहीं मिल पाती। ये स्थिति हम दिल्ली में नहीं चाहते किसी भी हालत में। तो अगर हमें ये लगने लगेगा किसी भी वक्त कि हमारा बेड्स जो है वो हम वी आर नॉट एबल टू कीप पेस विद इट, अगर हमें लगने लगा गया कि मेडिकल हेल्थ इंफ्रास्ट्रक्चर जो है वो कम पड़ता जा रहा है, तो उस वक्त हमें हो सकता है कि लॉकडाउन लगाना पड़े। आज की डेट में ऐसी स्थिति मुझे आते हुए नजर नहीं आ रही, बिकॉज अभी हम जिस तरह से नंबर ऑफ बेड्स बढ़ाते जा रहे हैं। अगले ही कुछ दिनों के अंदर हम और भी काफी बढ़ा रहे हैं। हमने केंद्र सरकार से भी आज मदद मांगी है। सुबह सुबह मेरी एलजी साहब से जो मीटिंग हुई थी, मैंने उनसे ये रिक्वेस्ट किया था, ऑनरेबल एलजी ऑफ दिल्ली, ही इज आल्सो गोइंग टू स्पीक टू द सेंट्रल गवर्नमेंट की सेंट्रल गवर्नमेंट भी इसमें मदद करे। वो कर भी रहे हैं, सेंट्रल गवर्नमेंट भी मदद कर रही है। तो हम कोशिश कर रहे हैं कि ज्यादा से ज्यादा इसकी कैपेसिटी को बहुत तेजी से बढ़ा सकें। आज की डेट में मेरे को नहीं लग रहा कि हम लॉकडाउन लगा रहे हैं।
Well, let's now shift our focus to Rajasthan, where a weekend curfew has been announced. This curfew starts this evening at 6 p.m. will continue until Monday morning 5 a.m. This is the latest decision that has been taken by the Chief Minister after a record 6,658 cases that were reported in the last 24 hours. Harsha Kumari Singh joins us with the very latest. Harsha, what more can you tell us?
Well, a late-night decision by the Chief Minister announced on social media, and the cases in Rajasthan are also rising alarmingly. 6,600 plus cases in Rajasthan. Across the districts, about 19 districts have reported more than 100 cases. 33 deaths have been reported, and the positivity rate has gone from what was about 2% mid-March, early March, to now almost 14 to 15%. There are about 30,000 plus active cases, and it is showing no signs of stopping. So, I mean, if you study the figures, they've been regularly going up each day. In fact, even a city like Jaipur has been reporting more than 1,000 cases per day. Now, as of now, the Rajasthan government does have health infrastructure which is able to cope. But if they carry on rising exponentially like they are doing right now, then it's going to be difficult. And that's the reason why a weekend curfew has been announced. Of course, a lot of this weekend curfew will depend on people's participation because in the earlier curbs that were announced, all that the exemptions will continue. Markets will have to shut by 5 o'clock. Everyone is requested to be home by 6 o'clock, but then exceptions are there. If you want to go out for milk or vegetables on the weekend, that's going to be available. Gas supply will be available. Banks will be open. Those who have to go for weddings, they are going to be allowed. So really, on one hand, there are restrictions, but on the other hand, there's not going to be strict enforcement because people who have a valid reason and are stepping out will probably be allowed to step out, because obviously if markets are, if you want to step out for milk and vegetables, then you're going to be able to do that. So really it depends on people's participation, and I think that really is what the Chief Minister is appealing for. Ironically, on 17th there's also voting in 3 by-elections in Rajasthan, and the voting exercise has been exempt from this weekend curfew.
All right, appreciate you, Harsha, for joining us with the very latest. Let's also get you an update now from Kerala, which has decided to do mass testing and has set a target of 2 lakh to 2.5 lakh for this weekend, for Friday and for Saturday. Sneha, it's extremely interesting. Kerala now deciding to do mass testing. Who is eligible to get tested and how is this going to be carried out?
Well, Rishika, it's interesting because it's literally mobilization of a lot of people at the ground level. So you have the whole network of ASHA workers, Kudumbashri people, and various health teams that would be mobilizing people on the ground to get more people tested from a cross section. Now they are aiming for around 2 to 2.5 lakh tests on Friday and Saturday cumulatively. And if we look at something like that, it's going to be much higher than what it used to be. If you look at 2 days, it would be 60,000 to 70,000 of what it would have been testings on a daily basis. Now, if you look at this, it would be around 2.5 in 2 days. So that is something that they are hoping will be able to identify those who are positive and isolate them and take it forward. Much of this would be the antigen tests. And depending upon what symptoms are found, if anybody is found with any symptoms, then the further step of RT-PCR tests would be taken. Now, what's the situation on the ground? The test positivity rate has been increasing. Currently, it's a little over 13. But if you look at the vaccination percentage, of course, Kerala has vaccinated around a little over 12% of its population. That also being welcome. And Kerala has also decided to intensify its vaccination process. There was an issue in Kerala, with some places, yesterday turning back people saying doses were over. Now, what has happened is, according to government sources, because these vaccination supply have been coming in a limited stock, in a restricted stock, they are not able to send all these to different places because of the buffering needs. Now, what the Chief Minister, during a meeting, according to sources, has decided that all these stocks would be completely exhausted, irrespective of how many come in, and there will not be any buffer as such which would be kept as a backup thing. So everything that is going to be coming is going to be sent out to the locations, and fresh demands would be made. So that will be have to see how that goes. So a lot of focus on vaccination as well as testing over the next few days in Kerala.
All right, appreciate you, Sneha, for joining us with the very latest. Let's now shift our focus to the state of Uttar Pradesh, which is seeing a huge spike in COVID-19 infections. For the second straight day, there have been over 20,000 positive cases, over 1 lakh active cases in the state at the moment. Now, the capital city of Lucknow is seeing the highest caseload. Markets in Lucknow have gone into a self-imposed lockdown. Meanwhile, in Varanasi, the authorities have urged tourists to stay away till the end of the month. Also, there is a bid to build walls around crematorium sites.
As Lucknow's COVID cases surged to record highs, a cover-up less than 24 hours after this horrifying video from Lucknow's main COVID crematorium. This is Lucknow's main COVID crematorium, from where those images have gone viral. While no on-record version is available about why it has been done, there's a notice there that says that this is a COVID-19 affected area and one cannot enter without permission, and that anyone who enters this area without permission, there will be legal action against that person. Lucknow now has 31,000 plus active COVID cases. Just 2 weeks ago, active cases were at 1/10 of this number. In the city's major markets, an unprecedented self-imposed lockdown for the next few days by trader associations. So why is this situation unprecedented? One reason is that this shutdown of markets by Lucknow traders goes against the stated UP government policy, where they've decided not to impose any day lockdown despite the COVID surge in UP, because they think that it will lead to economic distress.
The employees working with the shopkeepers and the shopkeepers at large had a feeling that we as a citizen should also do something, because this pandemic has spurred in a very rapid way in last couple of days. Everyone suggested that at least we should curb on the active marketing activities.
In Kanpur, where active COVID cases have gone up 1,500% in 2 weeks to 6,447, this desperate daughter, unable to find a bed for her ailing mother at the government COVID hospital.
यहाँ पे पहले हो जाएगा लेटर दिखाइए. अगर आपके पास नहीं तो आप सीधे बोलिए कि मेरे पास जगह नहीं है. आप लेटर का मतलब नहीं बनता ना. फिर लेटर दिखाइए, पहले आपको लेटर मंगवाया, लेटर दिखाया, अब जगह नहीं है यहाँ पे. कहीं भी बेड नहीं है, कहीं भी बेड नहीं है. हम कह रहे बेड नहीं है, भाड़ में जाए बेड, कम से कम जमीन में लगा के, बिस्तर लगा के पेशेंट को ट्रीटमेंट तो दीजिए. यहाँ एक केस नहीं है, बहुत सारे केस ऐसे लोग रोड पे घूम रहे हैं, ले लेके अपने पेरेंट्स को अपने.
In Prime Minister Modi's Lok Sabha constituency Varanasi, where active COVID cases crossed 10,000 on Wednesday from just 550 2 weeks ago, this appeal by the district magistrate asking visitors, both domestic and foreign, to avoid coming to the city till April end. Entry to the city's most famous religious site, the Kashi Vishwanath temple, will be allowed only after a COVID negative report. With Arun Agarwal and camera person Rajesh Gupta, this is Alok Pandey, NDTV.
Well, worrying story there of the shortage of beds, oxygen supply as cases continue to surge. The Election Commission today, interestingly, has called an all-party meeting to ensure the implementation of a Calcutta High Court order strictly adhering to COVID protocols during the remaining phases of the polls. Bengal has, remember, an 8-phase election. Only 4 phases are over. Huge crowds have been seen at political rallies, at road shows, with little or absolutely no social distancing or even masks in sight. Yesterday, Bengal recorded its highest single-day spike in coronavirus infections. Today, Chief Minister Mamata Banerjee and Home Minister Amit Shah are both addressing rallies. The TMC has urged the Election Commission to club the remaining 3 phases of the polls in order to curb the rise in COVID infections. Moniteepa joins us with the very latest. Moniteepa, over 5,800 cases in Bengal in the last 24 hours. This is the highest ever for the state. But political campaigning, large crowds continue to gather.
Well, Rishka, actually the number closer to 7,000. It's 6,800 odd fresh cases in the last 24 hours. That is the latest update we have on numbers. And there have been 22 deaths in the last 24 hours. And indeed, the panic here in Bengal is also growing. Also, after watching what is happening in New Delhi, I mean, given that you all now have a weekend curfew, you have all kinds of restrictions on movement of people. But here in Bengal, despite everything, despite growing numbers, the campaigning, the rallies, the road shows have been continuing unabated. The only thing that has happened is that the left parties have decided not to campaign in large numbers, only door-to-door campaigns with small number of people, whereas other parties are continuing business as usual. However, last evening we've had the Chief Minister tweet about it. She has said, if not the election of tomorrow, if not the election of the 22nd, perhaps the election of the last 2 phases on the 26th and 29th could be clubbed into one. It would save certainly the spread of the virus. However, as we all know, the Election Commission in New Delhi has categorically stated that there are no such plans to club any elections at the moment. But Trinamool going hammer and tongs and attacking the Election Commission for the 8-phase polls in the first place. Now, in the meantime, of course, as you mentioned, Calcutta High Court has passed a very stern order on the implementation of existing COVID protocols. And as a result, the CEO of the Election Commission here in Bengal has called an all-party meeting today, which will take place at 2, to ensure how these rules can be adhered to. The High Court has said the police may actually implement Section 144 prohibitory orders and take steps to ensure that COVID protocols are adhered to. 2 o'clock, Kolkata, all-party meeting.
All right. Thanks, Moniteepa, for joining us with that update. We'll keep coming back to you for more. Short break here on the broadcast. We'll be back with more on the other side. Stay with us. Well, a year ago, when India went into lockdown, thousands of migrants and daily wage earners had to make desperate and physically grueling journeys back home. Oxfam and NDTV came together then to provide humanitarian relief at a time of extreme crisis to the most marginalized and helping vulnerable communities recover. Oxfam and Can Support provided medical and ration relief to cancer patients and their families. Here's a special story.
Mausami Bansali is a Can Support counsellor who provides palliative care to cancer patients, visiting them in their homes and providing medicines and support. The lockdown meant that many hospitals were turned into COVID centres, interrupting treatment for many cancer patients. With the additional strain of containment zones and job losses, cancer patients and their families had no recourse to medical care and in many cases no food to eat either. It was then that Can Support and Oxfam came together to provide medical and ration support for cancer patients and their families affected by the pandemic.
मैडम चेकअप कराने में तो खैर सरकारी हॉस्पिटल की वजह से प्रॉब्लम तो हुई हमें और थोड़ा वहाँ प्राइवेट वालों ने भी हमारे टाइम ज़्यादा ले लिया 1.5 महीने लगा दिया उन्होंने भर्ती करने में हमें मुझे खाने पीने की बहुत परेशानी हो रही थी मगर ऑक्सफैम संस्था वालों ने मेरी बहुत मदद करी है इसलिए मेरी तकलीफें कम हुई
40-year-old Mithilesh, suffering from buccal mucosa, says he survived the lockdown only thanks to the help he got from Can Support and Oxfam. With his poor health, he was able to feed his 2 small children with the rations he received.
उसका जो वाइफ है वो भी कैंसर सपोर्ट का ट्रेनिंग के कारण उसको भी हमने कहीं जॉब पे लगाया है कि भाई उसको भी 2 पैसा आ सके क्योंकि अभी ये बिल्कुल नहीं काम कर सकता है.
The pandemic and all of its fear and uncertainty made dealing with cancer that much harder. But this support will have gone a long way in letting cancer patients live through very tough times, knowing they were not forgotten.